All right, so we are going to bring up a table for you guys. It's kind of a big snapshot of everything you need to know about informed consent. Again, these are big picture topics that we have on here, or big picture notes, high-level things for you to know. But again, take a screenshot of it. You can review it, use it like a flashcard. It'll hopefully be helpful for you guys. All right, so starting with just the very basics of informed consent. So informed consent is an agreement between the healthcare provider and the client prior to non-emergency surgeries and procedures. So non-emergency is kind of a key word there. So it has to be obtained by the healthcare provider or whoever is performing the procedure, which typically is a healthcare provider. If informed consent is not performed before the procedure, then the healthcare provider can actually be charged with battery. So when we think of battery, just think of like an attack or like an unlawful use of force. So we definitely don't want that to happen. The informed consent is going to protect everyone involved in the procedure. Okay, so there's going to be an exception to when informed consent is not necessary. So we're gonna warm up the chat. Let us know if you guys know the answer to this. So when is informed consent not necessary? So let us know what you think. And hello, everybody. I'm seeing so many highs on the chat. We're glad to have you guys here. And again, anyone on TikTok, make sure you guys share this video. The more the merrier. We want to help as many nursing students as possible. But again, if you guys know, drop it in the chat. When is informed consent not necessary? I'm seeing some good answers come in. Oh, good job. I see Alba on YouTube. When there is a trauma or emergency, a lot of good answers coming in. You guys definitely have that emergency. Yes. Okay, so thank you guys. Awesome. All right, so informed consent is not necessary in emergency situations like when the client is not conscious, but they require emergency life-saving intervention or procedures. So we leave it to the healthcare provider to act in the best interest of the client. Okay, so next thing we're going to do, we're going to cover some different types of consent. So I want you guys to, again, let's use the chat. Let's kind of warm it up a little bit more. Give us some examples of when consent is necessary. So you can kind of see it on that table, but if any of those are new or surprising to you guys, put them in the chat. We want to know. I think some of it might be surprising. Maybe even like immunizations we have on there. It's probably been a while since some of you have had to have an immunization. But again, that's let us know again whenever consent is necessary. Give us some examples. I'm starting to see some come in. Good job, you guys. Good answers coming in. A bunch of people coming in from Instagram, so we're glad to have you guys here. And hello, everyone on YouTube and Facebook. Before surgery, yes, that is right. Invasive surgery, correct. Diagnostics, yes, that's the case for some of them. Anything invasive. Good answers, you guys. You definitely have it. Okay, so let's walk through some of these times or examples of types of consent or when it's necessary. So starting big picture, whenever you're admitted into a hospital, you'll sign a consent for general treatment. So that's part of admission into the hospital. Again, it's going to protect those providers and the client themselves from receiving the treatment they need. Immunizations, again, you have to have a consent for before an immunization is given. Blood transfusion, this is a very important one, and every facility is going to be a little bit different, but you can have consent for blood transfusions kind of when clients are on the floor, and then maybe a different one that might be an exception or in addition to for surgery, things like that. Surgery obviously is another big one. Research, genetic testing. The reason we do that for genetic testing is because sometimes these clients can be receiving life-changing information, so we want them to be fully aware of the information they're about to receive. And then sometimes special situations. This is going to be kind of a catch-all for some miscellaneous things, but this can be a consent for restraints in like a non-emergency situation. An autopsy requires a consent. Photographing images for documentation or research purposes, anything like that. So again, there's a wide range of things that we need consent for, but the whole purpose of this is to make sure the client is aware, the healthcare provider has explained what they need to, and that everyone's protected. Okay, so let's talk about what is included in consent, so the components of consent. So there's a few things that need to be done before we have a client sign consent. So we call these like preconditions. Okay, so this is going to include like an assessment of capacity and competency. So capacity is the actual decision-making skill of the client. So can they be given information, then make a decision? So an example of this would be like if a client comes into the emergency department with appendicitis, the healthcare provider explains that like without an appendectomy, the client may die. So with that information, we need to be sure the client can appropriately make a decision in that situation. And then the other element is competency. So competency is like a legal judgment. So it's an assessment that the client has the legal right to make their own decisions. So guidelines for determining competency apply to all clients. So in talking about guidelines, like we'll talk a little bit about like mental illness. So clients with mental illness can give or withhold consent unless they have been deemed legally incompetent. So we're going to pause there and I'm going to ask you guys another question. So give us some conditions or situations that would fall under this umbrella of legally incompetent. So when a client is not able to make a decision for themselves. So let us know. Oh, and I'm seeing a lot of good questions come in here. Good answers, and everybody, I'm seeing our chat is moving and our content experts are responding. So again, ask us questions. We're here to help answer any of this for you. Good job, you guys. Okay, yeah, I'm seeing unresponsive patients, definitely, that's one. We'll talk a little bit, yeah, client is intubated. Mentally incompetent, good answers. Okay, good job, you guys. A lot, dementia, yes, that is a huge one, and delirium, so we'll talk about those. Okay, so a few examples of incompetency or being deemed legally incompetent would be a client who is like experiencing a psychotic episode or delirium. So, or someone that's like on mind-altering medications or substances like opioids or alcohol, when their, decision-making abilities are impaired. They can't think clearly. And then again, or a client that's already been deemed legally incompetent. So again, we have capacity and competency. So those are our preconditions, like what really goes into it. The next is voluntary. So informed consent needs to be voluntary. A client should never be forced into signing consent. It should definitely be something they choose to do on their own. So you never would want to bribe, like we're never going to bribe a client or coerce them into a procedure. They need to voluntarily be doing this. Another thing to note about any informed consent is that at any time a client can withdraw their informed consent. So let's say they signed a consent for a procedure, they're on their way down to that procedure for surgery, they change their mind and say, no, you know what, I don't want to do it. That's their right and we have to respect it. Okay, so the other kind of components of informed consent and what we are going to disclose or what the healthcare provider is going to disclose, we're going to walk through all of those. Okay. So what's actually talked about in an informed consent? So we're going to talk about their diagnosis. So essentially what the procedure is addressing, what the treatment is trying to fix. Then we're going to talk about the planned treatment or procedure itself. So again, this is where we might need to involve like an interpreter to ensure that the information being explained to the client is being given in a way they can understand. So the healthcare provider also needs to discuss the probability of a successful outcome. And then on the flip side, they need to kind of cover those risks and complications. So primarily they're going to talk about those common complications, but they also need to discuss some of those more rare complications and even the risk of death, if that's something that can happen with the procedure. And then also they need to make sure and inform the client if there's alternate treatment options. So again, the healthcare provider, this is all up to them. And then lastly, a prognosis without intervention. So they need to tell the client, if you don't have this procedure, this is what your prognosis is, this is what you can expect. And again, the whole point of this is giving the client all the information they need to make an informed decision that's acting in the best interest of themselves. And then again, a client can say no at any time. So a quick review, we're going to have in the informed consent, we're going to talk about diagnosis of the client, what the procedure entails, risk and benefits, successful outcome, or I'm sorry, not risks and benefits, risks and complications, and then alternative treatment and prognosis without intervention. And then again, they can say no at any time. We have to respect that. We have to respect that decision. Okay, so we're going to talk about a couple special considerations, and so we'll talk a little bit about minors and then also research or clinical trials. Okay. So again, a few kind of special considerations to talk about. Let's talk about consent for incompetent clients. So we're going to reach out to the next of kin, the legal guardian, or medical power of attorney when we need to obtain consent. So last week we did our lecture on end-of-life care, and we talked about the importance of having a medical power of attorney. And you can really see in situations like this, you need a medical decision maker if you're not able to make those decisions yourself. And that's the case in a client that's been deemed legally incompetent. So again, we need to have that medical power of attorney, a medical decision maker. So again, you can see in these kind of situations where it's essential and it's crucial that somebody's been identified. Other special considerations are going to be minors. So laws are going to vary state to state. Facilities are going to have specific laws as well, but in some cases, a minor can consent for themselves if they're under the age of 18. Again, it's going to be state to state, facility to facility. But think about if there's maybe a 16-year-old who requires a C-section. In some situations, they're going to be able to consent to that procedure. But in most cases, a parent or legal guardian is going to sign the consent on behalf of that minor. But again, you're going to know in these situations, if you're dealing with a minor requiring consent, you're going to know what you need to do. And that's the whole point of having like the legal and ethics boards in in your facility and having these things already fleshed out so there's no questions. Okay, last thing before we talk about the role of the nurse in informed consent, we're going to talk briefly about clinical trials. So in the same vein as these like special cases, that's kind of how clinical trials fall. So they're going to require consent as well, but informed consent is typically going to be obtained by a member of the research team. So this person's going to talk about, again, the risks, the consequences, the benefits associated with participating in that clinical research or in that clinical study, and also the purpose of the study itself. So with my background being in oncology, we were involved in a lot of clinical trials, and that's a huge part, is making sure the client is fully aware of how they're interacting in the clinical research or in the study, what they may or may not be receiving and what to expect. So again, the whole point of research is to gain new information and new outcomes. So we have to explain kind of the risk associated with some of these new treatments and what they can expect. A lot of times too, this can be, these clients are followed for longer than just a visit. It'll be like a multi-year commitment to being in a study. So they can track the long-term effects, kind of short-term effects of, any type of medication that's given or procedure that's performed. And again, they can withdraw at any time. That's totally their right. They can decide to remove themselves from the trial. Okay, we're in the home stretch. Let's see here. We're going to talk about the role of the nurse in informed consent, and this is so important for all of you guys to know, so you're never in a sticky situation. But I'm going to ask you guys a true or false question, and I want to know what you guys think. Okay, true or false? So put your answer in the chat. The role of the nurse is to give detailed information about a procedure to the client. So true or false, the role of the nurse is to give detailed information about a procedure to the client. Let's see what you got. Let's see what you got. True or false, the role of the nurse is to give detailed information about a procedure. False, yes. Good answers coming in. Good work, you guys. I'm seeing a bunch come in. Awesome, awesome. Good work, everybody on YouTube and Facebook. I'm seeing a lot of good answers come in. Awesome. Okay, yes. I'm seeing no's, falses, all good answers. Okay, good job. Yes, healthcare provider does it. Good answers, you guys. Okay, the answer is false. The role of the nurse is very clear with informed consent. So a nurse is not required and not responsible to give detailed information about a procedure. That's the role of the healthcare provider. So what does the nurse do? So nurses can witness and verify a voluntary client signature. So let's say a physician or a healthcare provider explained the procedure. The clients had many appointments leading up to this. The nurse can verify that the client is signing the informed consent, but it's not up to the nurse to describe everything involved in like open heart surgery. The nurse can clarify facts that have already been given by the healthcare provider, and they can also ensure like competence and understanding of a procedure and of like the care of after the procedure, like the healthcare plan. So like wound care, diet, any aftercare. So again, it's really up to them to ensure that they're competent, they understand. And then lastly, we never modify an informed consent once it's been signed. Leave it as is, don't touch anything, don't add anything in. Once it's signed, it's final. Okay, you guys, that was informed consent. I hope this was helpful. I hope this was kind of a good digestible amount of information to know about informed consent. We're going to hop into our questions now. So we have 3 questions to check your understanding. So stick with us on those, and then that'll be it for today. Okay, so we'll pull up our first question. I'll read it, give you guys some time to answer, and then we'll walk through it. I'll see how we're doing if we need to spend a lot of time on any of these. Okay, so question 1. The nurse is caring for a client who is scheduled for a surgical procedure in 1 hour. The client states, I do not understand why I need surgery. Which of the following actions would be a priority for the nurse to take? Option 1, inform the nurse manager that the client requires additional information. Option 2, notify the operating room that the procedure may need to be delayed. Option 3, provide the client with an educational pamphlet about the procedure. Option 4, request that the healthcare provider address the client's concerns. All right, I'll give you guys some time, and I'll talk about 2 as you guys are answering. I'm seeing a lot of good answers come in. Good job, you guys. So tomorrow, I hope you guys will come and join us at 3 p.m. on TikTok and Instagram. We're going to do a question drill set. So we walk through a good number of questions, anywhere between 7 and 10, and give you guys just a lot of question practice. So come back 3 p.m. Central Time tomorrow, TikTok and Instagram. But good job, good answers, you guys. You crushed it. I'm seeing like 100% accuracy, so good work. Okay, so our correct answer on this one is going to be option 4. So request that the healthcare provider address the client's concerns. Okay, so our question, it says priority. That's the first thing we need to do. We don't want to assume that any of these other things need to be done until we contact the healthcare provider. Again, it's up to the healthcare provider to explain the details of the procedure. It's not up to the nurse. So we're gonna just like stop the line, call the healthcare provider, make sure there's understanding before we delay anything. We're definitely not going to give them a pamphlet. That can be something that's going to reinforce, but we need them to talk to that healthcare provider. And then our nurse manager is going to tell us the same thing. We need to call the healthcare provider. We don't want to delay anything, just go straight to the source. Okay, and also it's not the role of the nurse manager to explain the procedure either. All right, moving along. Great job, you guys. Okay, so question 2. The nurse has attended a staff education program about informed consent. Which of the following statements by the nurse would require follow-up? Option 1, informed consent requirements regarding clients less than age 18 vary by region and by situation. Option 2, clients who consent to a surgical procedure are required to consent to a blood transfusion. Option 3, the healthcare provider must provide information in the client's preferred language for informed consent. Option 4, the nurse's role is to witness the client's voluntary signature and verify the client's comprehension. All right, let us know what you think. Put your answers in the chat. Let us know. Good work, you guys. And as always, these live sessions will be available on whatever channel you're watching it on when we're done. So check them out on Facebook and YouTube especially. And we have a great now that we've done these almost, throughout the summer, kind of the remainder of the school year, we have a really good kind of selection and bank of these videos that you guys can check your understanding on, and lots of our question drills as well. So we hope it can be helpful for you guys, in addition to all your other studying that you're doing. Okay, so I'm seeing a good mix of answers on this one. So we will walk through some of these options in a little bit more detail, but thanks to everyone who's responding, a bunch of people joining us on TikTok today and Instagram. So glad to have y'all here, and YouTube. Awesome. Okay. All right, so our correct answer for this one is going to be option 2. Okay, so again, the question itself, starting at the beginning, it says statements by the nurse that would require follow-up. So again, clients who consent to a surgical procedure are required to consent to a blood transfusion. That's not the case. Some clients in certain religion, it's a religious preference not to receive blood. So blood is its own consent and something that is kind of independent. And if it is included in the consent for surgery, then the client needs to be aware that it's part of it and they can decline, and maybe a different consent is then given. So again, blood is not anything that someone has to consent to. It's something you're voluntarily doing. So let's see. Again, I think maybe some of this tripped you guys up on the follow-up. So again, option 1, this is true. We talked a little bit about for informed consent for minors. In some situations, in some cases, a minor can consent. But again, it's going to vary by state. It's going to vary by facility. Everything is going to be very situational. But no matter what situation you're in as the nurse, you're going to know the right answer to those questions. And then again, we have to talk to our clients in a way they're going to understand. So that's kind of what relates to option 3. And then again, what's being described in option 4, that is the role of the nurse. We can witness a signature, and then we can also verify. We talked again about that. Capacity and competency. So that's kind of what that one's describing. So good job, you guys. Okay, last question. Question 3. The nurse is caring for assigned clients who are scheduled for surgical procedures. The nurse should recognize that the client who cannot legally provide informed consent is the client. Option 1, who has delirium tremens and had a seizure 2 hours ago. Option 2, with bipolar 1 disorder who reports consistently sleeping through the night. Option 3, with autism spectrum disorder who lives independently. Option 4, with schizophrenia who last experienced hallucinations 7 months ago. All right. So we are looking for the client who cannot legally provide informed consent. All right. So I will see what you guys think. Good work, everybody. Awesome. Oh, thanks to everyone who's talking about, we love to see how you guys like to study. We hope your choice is UWorld. We have lots of great information in our question bank, and we'll talk a little bit about that next, but awesome. All right. I'm seeing a bunch of good answers come in. Good job, you guys. Okay, so our correct answer, again, cannot legally provide informed consent. That's going to be our client in option 1. So again, they're not in a frame of mind where they're able to make, with delirium, that's not going to be something that is going to allow them to have that capacity and that competency to make a decision. All of our other answers, you guys did really good. Those clients can make informed decisions for themselves. So good work, you guys. Awesome. Again, I think you guys did really great. Yeah, exactly. Patient, the client in option 1, they're disoriented. They have delirium. Our other clients, they're stable. They're showing that decision-making capability. So just a reminder for the remainder of the week, tomorrow at 3 p.m. Central Time on TikTok and Instagram, come join us. We're going to be doing a respiratory question drill. On Thursday, same time, 3 p.m. Central Time, TikTok and Instagram, we're going to be going through some of our most missed questions. Again, this is going to be such a wide range of topics, and we'll go a little bit more in depth for them. So we hope you guys will come back. We had a lot of you guys join us last Thursday for our most missed question drill, so we're going to do another one of those for you guys with some more most missed questions. But as always, thank you guys so much for joining. We hope you you guys will check us out at nursing.uworld.com. We have a 7-day free trial. We hope you will check it out. It's going to give you an amazing idea of what UWorld's all about, from our questions, illustrations, explanations, the learning that happens, our lecture videos, NGN items, all of that. That's going to help you prepare for your NCLEX and also be successful in nursing school as you guys are kind of getting ready to get back into the swing of things for the school year ahead. We have tons and tons of questions that's and lecture videos that are really going to supplement what you guys are learning in the classroom. So as always, we thank you guys for joining us. Come back and see us tomorrow at 3 p.m. Central, and we'll see you next time. Bye.